Welcome back to Virginia This Morning.
This Partners in Healthcare segment is sponsored by Maxim Healthcare Services. Established in 1988 by a small group of recruiters responding to the nursing shortage, today Maxim Healthcare Services offers support in a number of different ways across the country. Ryan May is with us this morning, and we had the chance to talk a little bit before we came on. Maxim is a big company.
Yes, ma'am. We've actually become one of the largest providers nationally with over 400 locations across the nation.
And based right here in Richmond, you've got a good group of folks doing all sorts of things, providing all sorts of care.
Yes, ma'am, absolutely. Our team is here in Central Virginia, actually right down the street from the station. We do have an awesome team behind the scenes that really work very hard to make things happen. I'm just very blessed to be part of the team.
And at the heart of things, Maxim Healthcare Services provides a lot of different services, but today we're talking primarily about the opportunity really for families to keep a loved one at home and provide that kind of care, maybe if they don't want to go to assisted living or nursing home.
Yeah, absolutely. With all the different services we provide really in the healthcare field, today is really to help educate families about the differences between what they may hear in home health and home care. A lot of families, they have a loved one in a hospital setting, and it's kind of a very challenging time for them to really help navigate the system to figure out what's really going on. The first thing that comes to mind is home health is mostly Medicare. A lot of times the Medicare will pay for physical therapy or RN visits, CNA visits once they come home. That's not really what we do. We don't accept Medicare. A lot of people are surprised in that fact. What we do is really focus on the home care side of things, and it's private duty nursing. It's having a one-on-one caretaker in your home, sometimes 24 hours a day, for both adults and for pediatric populations throughout the area.
And I think unless you're at the place where you're starting to look for this service, you may not know the questions to ask. You may not realize that this is an option you have available.
Absolutely. And I get calls all the time, even if it's not somebody we end up providing care to. That's part of the challenge for me. It's a unique opportunity to help impact their lives by helping educate the families to know where to go and who to turn. Partners in Healthcare is a great opportunity for us to share that information with other competitors really all across the area to get them to the end goal.
And different specialties of nursing as well involved with your team.
Correct. Anything from a CNA, which is a certified nurse's aide, to an LPN, licensed practical nurse, to an RN, which is a registered nurse, for all skill levels. We have clients in the home that are ventilator dependent, that have a tracheostomy, that had a G-tube feedings. We have a lot of patients with ALS or with prematurity for some of the babies. So really all levels of care.
And maybe people who are discovering this today may say, well, geez, how do I pay for this? It's not Medicare, but there are other options there for paying.
That's a great question, Jessica. We work with every national insurance that's really out there. Again, the only thing we don't accept is the Medicare. A lot of those programs will be surprised. The families will be surprised to learn that there is a benefit within their policy that could potentially help offset some of the costs of our services to come in on site. It's really a matter of one, speaking with the families, finding out what the level of need is there for their loved one, and really doing some of the legwork for those families to call these insurances and ask them what benefits are there to help assist these families in needs.
And as we were talking a little bit earlier, as one of the partners in healthcare, you will do your best to help, but if you're not, you're part of this network of resources to point people in the right direction.
Absolutely. Again, it's a great network of a lot of good friends that we really work amongst ourselves to try to find better ways to help get the information to the families that maybe they're not on the inside of healthcare. They don't understand all the ins and outs and a lot of the acronyms. We help them navigate the system as well, and if we can't help them, again, put them in the right place, help make a difference.
When my mother started the care of my grandmother at the time, this would have been the sort of resource that we wished we had in place.
Absolutely. Well, that's wonderful.
So people can get started by calling you, and you go through that evaluation process.
Yes, ma'am. We'll definitely take the time to speak with them to find out what their specific needs are, talk with them about the funding, because there's two things that really have to happen. The family dynamics of the family support has to be there, and also, again, the funding. Who is going to help provide the monies to pay for that service? And there's a ton of different avenues. We'll help explore those through long-term care insurances that we work with. We do work with some Medicaid waivers. It's a big question we get a lot. Do you work with Medicaid waivers? We do, and we help to try to make a difference through those. And then there's also the option of privately paying. In this day and age, a lot of families are going to reverse mortgages to find funds to help keep their loved ones in a home care setting, where we come in and provide the one-on-one care. The other question is, how much does it cost?
And we talked a little bit about that price point, and I think people will be surprised to find. So let's let them know how to get in touch with you.
Absolutely.
Get in touch with Maxim Healthcare Services, one of your partners in healthcare, by calling 355-9800. You can stop by their office. It is right around the corner from the station, 3805 Cutshaw Avenue. They're in Suite 100. That's right here in Richmond. And you can visit online, maxhealth.com.